Neville, yes.
Yeah, thank you, that's Ciarán. Just to say that obviously I'm very mindful of the sensitivities of visitors and members of the House that may have been directly affected by mental health issues before I speak. I think we all have to be mindful of that. I obviously welcome the establishment of the National Task Force on Youth and Mental Health in researching how best to introduce and teach resilience and coping mechanisms in children and young people to, I suppose, allow them to develop that mechanism over the course of their lifetime. Things have changed over the past number of years, over the past decade. I suppose when Visions of Change came in 2006, I remember campaigning in elections where we spoke directly about mental health on doors and had pamphlets, etc., through 2-3 elections ago. And at times, Ireland was a different place back then, and you would get funny looks on the door actually bringing it up. People didn't want to talk about it, you know. And I welcome today that people actually bring it out in the open and speak about it. I welcome the fact that deputies will stand up and speak about it, because not so long ago in this House, they didn't, and that was the bottom line. Secondly, the big thing, as I've always mentioned, is that stigma needs to be combated. We were at our thinking, Fine Gael thinking, and we did have a discussion around mental health, and we did have some thought leaders that came in and spoke to us, and the one thing that I did pick up from that was that stigma kills, and we need to combat stigma. That is the major issue out there. I also want to bring in some other kind of, I suppose, newer avenues at looking at helping with mental health. That would be through the creative arts and the artistic approach, which is quite therapeutic. It allows one to go beyond themselves, and also the use of data analytics as well. I know there has been some sort of analytics being put forward in the last number of years, particularly in the corporate world, to measure work stress, to measure why people are missing work, and to measure trauma within work as well. And there's no reason why that can't be diversified across into the health service sector as well. Thank you.
Oh my God. There are still 4 minutes for